I have a stroke every 2 years. That was a comment from one of our followers on one of the videos that I posted. And that was disturbing. To have a stroke every 2 years, there's something wrong here. Either the patient is not following with the neurologist or the patient is not assessed correctly. Because typically if you have a stroke, we follow up with the patient and we try to do our best to prevent the stroke from recurring. How do we do this? First of all, we have to assess the risk factor for stroke in this patient. So we assess the risk factors including high blood pressure, diabetes, high cholesterol, cardiac arrhythmias, carotid stenosis, obstructive sleep apnea. We assess all those risk factors, especially smoking, and we correct the risk factors. If we treat or correct the risk factors, then we lessen the risk of having another stroke. The second thing is we treat it appropriately with a blood thinner or antiplatelets. It could be aspirin, it could be Plavix, it could be any other antiplatelets or anticoagulant depending on the type of a stroke. The bottom line is we try to prevent the stroke from recurring. If the stroke recurred while the patient taking a blood thinner, then that means the blood thinner is a failure and we have to switch the patient to another blood thinner. So if you have a stroke, you should follow up closely and regularly with your neurologist to keep assessing you to, first of all, correct any risk factor that you have to have recurrent to stroke and to assess that you are on the correct blood thinner. Thank you.